Good morning, ladies and gentlemen. My name is Dominic Millette. I'm a Chief of Operations with the Canada Border Services Agency here in Halifax. I'm very pleased to be joined here by Surgeon Keith McKinnon of the RCMP. I'm extremely pleased to announce that Border Services Officer have seized 459 kilograms of suspected cocaine from the Port of Halifax. This massive seizure means that we have prevented hundreds of thousands of individual doses of this dangerous and illegal drugs from reaching our communities and being sold on our streets. On Wednesday, October 29th, Border Services Officer examined a Halifax-bound container originating from Argentina and transiting through Panama. Officers used large-scale imaging technology to scan the container. Officers noted inconsistencies in the image and proceeded to open the containers on the waterfront, where they discovered 8 duffel bags. They immediately sent the container to our container examination facility to be fully offloaded. During the examination, officers discovered 400 bricks of suspected cocaine, each duffel bag containing 50 bricks, each bricks weighing about 1 kilogram. This is a massive drug seizure, let there be no mistake. Once seized, the contraband was turned over to the RCMP for investigation. CBSA officers are the first line of defense in protecting Canadians against the devastating social impacts of such contraband entering our country. Through gathering intelligence, using risk assessment methods, and with the help of state-of-the-art detection technology equipment, the CBSA continues to stop those carefully planned and elaborate smuggling attempts. We are extremely proud of the work that our officers do to protect Canadians. We will continue to work with the RCMP as well as our other law enforcement partner to prevent drugs from entering Canada, while at the same time ensuring that legitimate businesses and travelers are welcome to Canada. Surgeon Keith McKinnon and I will now take a few questions.
If we were to break this down into grams and the street value, what kind of numbers are we talking about there?
This seizure represents approximately 18 million, in excess of 18 million dosage units on the street. The cocaine before you has been tested preliminarily by investigators, and it is testing of a very high purity, indicating that it has not been stepped on or adulterated by other substances yet, and that would literally multiply its volume by a factor of 4. So in reality, you're seeing 4 times this quantity would be reaching the streets. It's very important through our partnership that we interdict such large quantities of cocaine from affecting our communities.
Now, is this any of this local supply, or is this so much that it was all of the Maritimes or all of Eastern Canada? Where do you think it was all going?
That's subject to investigation at this time, and it's too preliminary for me to disclose that. In the past, these shipments, as the one in February of 111 kilograms, when they arrive through Halifax, you can be sure that some will find its way to the local market, but I'm not at liberty to discuss where it was actually destined.
Arrests?
Any arrests?
There have been no arrests made at this time, and our investigation is ongoing.
Why have you gone public so quickly? In previous seizures like this, you will let it look as if it's going to make its destination in Montreal or Toronto and make arrests there. Is there something different about this seizure that you've gone public so quickly after making the seizure?
In partnership with CBSA, the Canadian Border Services Agency, we sit down and we do risk assessments on each file of this type. And in this situation specifically, we found no risk in making the press release at this time.
Whose coke is it, do you think? Is there any indication? I don't think Argentina is normally considered a source, but I know that there might be some that comes through Panama. Have you been able to ascertain where it got onto the ship?
We can't discuss that at this time. However, we can say that such quantities of this magnitude are typically orchestrated by elements of organized crime, which makes it a significant international problem. And through our partners with CBSA and international policing partners, we work hard to interdict such shipments.
Was this stuff supposed to get off the boat in Halifax?
I can't comment on that at this time.
What about the packaging, the way it was, what does that tell us, the way it was packaged, especially with the brand name that's on it?
Sometimes organized crime groups will mark their specific loads per se with packaging that's very recognizable to that organization. That's typically, we've seen that very frequently in the past.
Louis Vuitton was a maker of luggage and purses and things. What was the purpose of putting that brand on these bricks of cocaine?
I can't comment on that. I can only say that it is a branding that they use.
Was there also alcohol in the ship?
Yes, there was. There was 1,216 cases of alcohol, a mix of red and white wine in the container.
And it was Argentinian white wine, red white wine?
I can presume it was, but I'd have to verify, yes.
You said this was large. Can you put it in some perspective relative to other seizures you've made, say, in Eastern Canada?
Every drug seizure is significant from our perspective. That being said, in terms of numbers, and we were sitting here together about 4 months ago, and we were talking about a seizure of 46 kilograms. This is 10 times the amount. This is probably the third largest seizure in Atlantic Canada for cocaine.
And this stuff you're saying is as pure as it gets?
It's preliminarily, it's tested very pure. We don't have a quantifiable percentage. I've seen seizures like this in the past and previous postings where it's rated up around 90% pure. I can't comment on the purity of this, but it is unadulterated by our estimations at this time.
You hadn't answered how much it would be valued on the street.
It's important for us, when you talk about street value, we don't like to legitimize or glorify street value per se. It's just a number. We look at harms. If you look at 18 million dosage units in total, just think of the harms that would have in the communities to youth and so on. That is a lot of cocaine. Such a substantial amount represents addiction, a lot of addiction. And people use these drugs that frequently people get addicted and so on. There's significant healthcare costs associated with that. So it's very important that we look at it in terms of the community impact. So a dollar value to us, 10 million, 100 million is insignificant. It's the harms associated to the public. 18 million dosage units is a lot of cocaine.